You work with a lot of healthcare entrepreneurs. What is holding them back?
You can look someone in the eye and just say confidently and comfortably that, it's going to cost $200, $300, whatever the number is, and make sure that you're giving them double that experience.
When I'm thinking about being value-driven, what does that look like?
Now, doctors need to be best practice and evidence-based. They need to be the best solution to a problem.
If you are a healthcare entrepreneur, you are probably facing the pinch of insurance, and with that, the ripple effect on the rest of your business. If you want to find out what to do about it, I'm here with Dr. Lance Knaub, business coach and strategist. Lance, what's the landscape right now for healthcare entrepreneurs?
John, first of all, thanks for having me.
Absolutely.
The studio's gorgeous.
Oh, thank you.
This is going to be a fun conversation. We've gotten to know each other so well over the last few years. Yeah, the landscape is wild right now. And insurance companies have so much leverage, so much control, and they are continuing progressively to decrease the reimbursement for the best healthcare providers. And speaking about, my profession as a physical therapist, it's really an unlevel playing field where actually the worst providers often get the biggest reimbursement. And there's at least 20% greater reimbursement for some of the private equity-backed companies, and the healthcare systems 2 and 3x off of the more quality-focused, kind of independent practitioners. And it's the same among the physicians and dentists. It's really wild right now.
And you've seen this as a directional thing. It's been getting worse.
Correct. And, again, speaking about physical therapists and kind of the hierarchy of healthcare, let's say physicians are at the top. And it really, like, primary cares would be on the bottom of the totem pole of physicians. So a lot of it comes down to legislative and lobbying efforts and some of the things that you really just don't hear about.
And just so we don't offend anybody, for primary care physicians especially, when you say totem pole, what do you mean in terms of that sort of?
Yeah. So it's really kind of, probably say it's simplest, the specialization ladder.
Mm-hmm.
So, the more specialized you are, the more revenue you're going to be able to generate, the more earning potential you have, the more you're going to be able to have a bigger PAC, political action committee, and contribute to legislative stuff, have lobbyists, and the more leverage you're going to have. For example, I had a practice manager of a urology group about 15 years ago that I met, and they were about to get a 30% decrease in their single code that is their 90% charge, 90% of the time. And through their political action committee, within a matter of months, they actually were able to reverse that from like a 30% decrease to like a 20% gain. Now,
Fascinating.
that would never happen in physical therapy, probably wouldn't happen in primary care and all the various levels.
Got it. So the specialists are able to afford those lobbyists and are
Correct.
able to get that leverage. And so it's a couple L words there, right? Lobbyist, leverage. And so, okay, our objective here isn't to talk public policy, right? We're talking about how do you react to these things as a business owner, as an entrepreneur. So to bringing that down to that level. And before we jump into that, just for a brief moment,
Sure.
Tell us about your background, because yes, you're a business coach and strategist. We've also mentioned physical therapy. For somebody watching this and who doesn't know who you are, that's a pretty interesting pedigree. So tell me about your background a little bit, just so people know that you know what you're talking about.
For sure. Well, thanks for asking. Yeah. So my wife and I are both physical therapists. We worked for a couple of years, and I really wanted to master my crafts, got my doctorate in physical therapy, became board certified in orthopedics, was a strength and conditioning specialist, had all the credentials. Pretty quickly realized that the profession could be better, and I wanted to help make it better. And my wife and I uniquely wanted to bring physical therapy together with fitness. We rented 300 square feet from a little boutique fitness center in Medford, New Jersey, southern New Jersey, between Philadelphia and the ocean, the shore. And we, through good quality care, were able to grow our practice and expand our team and locations. I really studied partnerships because I wanted physical therapists to have a equity track, just like many physicians and attorneys. And some of our best and brightest joined us as partners. And around 2015, one of our best people said they wanted to run the company. And at first I was shocked and scared and nervous. I took a deep breath and realized this could be good. And then over 3 years, I continued to groom them. And in 2018, they took over the CEO role of our 5-location multi-million-dollar practice. which was our first child and, biggest investment. So it was scary and exciting all at the same time. I tried to figure out what I wanted to do next with my life, talked to a franchise broker, realized I was a little too entrepreneurial to be a franchisee. But I realized pretty quickly that I just wanted to help other entrepreneurs. So I wrote a book, The 4% Breakthrough, kind of put all of my hard-earned lessons into a process and just started serving other entrepreneurs through a new coaching company.
Amazing. So you definitely, it feels very much, and you and I are both fans of Michael Gerber
Yeah.
and the E-Myth, so it very much follows that track of that like technician perfecting his craft, realizing you need to be in the management space and then entrepreneurial space, and all of a sudden, delegating, right, and exiting. So I think that that's really important context for folks listening to this to understand your background and then how you're able to help folks. So again, going back to the main topic here,
Yeah.
which is we're not trying to talk public policy or how to start your lobbying group to solve for these issues where insurance companies are pinching these healthcare providers. But as a healthcare entrepreneur, what can you do to react to these things, right? And so, Lance, what's kind of the when you're working with somebody as a coach and a strategist, what's one of the things that you sort of recommend as a strategy that's going to speak to that ripple effect we talked about at the top of the episode?
Yeah, it definitely strategy is one of my favorite words, as you know, and, a big advocate for not just taking action, but taking an additional 10% of your year, month, week, and day to be intentional and take some strategic action. So with that being said, there's a dermatologist I work with who's, fired his lowest two insurance companies and has a direct care model is what he calls it, where people are actually getting a better value without using their insurance.
Got it.
There's a general surgeon in Indiana who's also innovative, and for a couple years, he was learning how to bill insurance companies and how to manage accounts receivable. It's a nightmare. It puts healthcare businesses, out of business consistently. And he's now getting paid directly, and the healthcare systems are dealing with the insurance reimbursement and all the delays and denials and all
Right.
that pain. And then, many healthcare practitioners, functional medicine doctor and nurse practitioner that I work with, that's not really traditional normal medicine anyway. So they kind of lend themselves towards self-pay. But even if you are traditional medicine, as the dermatologist I recommended, you can kind of move towards that model a little bit. So there's several options, but definitely you need to be strategic and make it fit to your world.
Well, just a kind of, I'm going to push back, but it's really a
Yeah,
T-ball moment
please.
for you to knock this out of the park. If I'm listening to this and I just go, "Oh, cool, I'll just drop insurance and only do self-pay," right? That is an option, obviously, but there's a ripple effect impact on your business from all those things that you're going to do. There needs to be an approach that you take, right? And if you're going to stay within those insurance spaces,
Yeah.
how you handle that. So I know something we talked about off camera was delegation and helping folks stop doing that, all of that cumbersome insurance work themselves. So I'll give you the Robert Frost moment here. Which path would you like to take more? Is speaking to, hey, how do I start that process of going to self-care? Is it just literally cannonball into the pool and say, hey, we no longer accept insurance here and good luck? Or is there more to it? Or the other option, which would be that delegation model that we talked about off camera.
Yeah, I think the right approach would be modeling it out, right? Definitely break out your spreadsheets and look at your current model and path and whether or not you're going to be expecting decreases like the physical therapy world, or whether you can expect to stay flat like many healthcare entrepreneurs, and your costs are going to unfortunately increase. And then if you look at a self-care model where you probably have lower numbers, and you could look at the primary cares and the concierge model where they really just take several hundred people, and they either pay a flat fee up front and they use insurance or don't, but they actually go from seeing 40 patients a day to seeing 8 patients a day, and 10-minute visits to an hour visit, and everybody is way happier and healthier. So yeah, a little bit of a planning, and I do know that kind of pro formas and budgeting and projecting is very difficult work, for entrepreneurs.
Yeah.
That would be a good place to start. And to me, that's kind of the strategic planning part of things.
So it sounds like, you model and you plan based on the idea of, hey, can I really step away from insurance fully
Yeah.
versus based on my business model? And so obviously it's not a one size fits all. So let's talk about that for a second.
Yeah.
Is it I'm not as familiar in the healthcare space, so if this is off base, let me know. But are you able to kind of say, hey, if you're in this area of medicine, you're probably going to need to stay with the insurance space, and you're going to need to figure out how to just make that more efficient? Or versus B, hey, if you're in these types of healthcare practices, you're good. You could probably start to say, transition into this model. Yeah,
No, great question. I think that it would depend on your goals. And I always am a big fan of thinking with the end in mind. So
yeah,
I think your vision and whether you're going to build something to keep or build something to sell does depend. But I would actually kind of remove that limiting belief that physical therapists to be successful have to be in network. And even in the past, if you wanted to have a private equity exit, which is the next part of my story, our partner did a great job running our business and we powered through the pandemic. And, kind of a compliment, private equity saw us, was attracted to us and wanted to buy us. And,
yeah,
when you don't want to sell and private equity wants to buy, that's a good place to be. So in 2021, we ultimately partnered. So I sold the majority of the business to private equity. And then in 23 months, they 5X'd the business and we had a recapitalization. So just a little bit more background and part of my journey and story. But yeah, I think it really depends on what you want to build. And I'm a massive advocate. I think one approach that's underutilized that I really want to share with the world is building your team, kind of Tony Robbins' words, but also building a self-managing company by leveraging the partnership tool and really building win-win-wins.
yep,
Because, for example, I was at the Private Practice Physical Therapy Conference last year, and everyone's only thinking about a private equity exit.
sure.
However, in 2018, when we had our self-managing business, and I met with my CEO partner once a month and had, a lot of profit for semi-passive business, that was a pretty sweet scenario.
That's awesome. So I guess if somebody's looking at this right now and they are considering, they're watching this because they're already feeling the pinch, right? And they're feeling that pressure. They're feeling, costs are rising, profits aren't growing, or revenue's not able to grow because of these ceilings that are in. And it sounds like very much and I don't want to put words in your mouth, but advocating for that. Hey, go, out of network, and take that
Certainly an
risk.
option to consider,
And
even
so
partially as in that dermatology example.
got it right.
Yeah.
And so that hybrid model,
Right.
what are the top 3 things you'd recommend right now for somebody to start doing if they're considering this, right? So they, I know you mentioned earlier, hey, take 10% of your time. Well, if you see patients 100% of your time,
Yeah.
something's got to give, right? So what are some recommendations right there that you would make off the bat to start?
Yeah, I think one thing to consider is being able to look someone in the eye and say that this is a $200 visit. Because whether a lot of times healthcare practitioners are sort of protected and buffered because it's insurance, but they don't realize I had to speak to our physical therapist every day and say, this should be $100 visit experience. So make sure that if you didn't have insurance and you are going to go to this type of model, you can look someone in the eye and just say confidently and comfortably that, it's going to cost $200, $300, whatever the number is, and make sure that you're giving them double that experience. And then to do that consistently, you are going to need all those systems and processes that you've touched on so that every practitioner delivers it the same way. And it's not just going to be a Lance Knob, the founder or the,
Right.
owner that only gives that experience.
It's got to be everybody.
It really has to be consistent.
What do you see as the biggest factor or the biggest factors that limit people from being able to do that? To look people in the eye and say, hey, this is going to be a $200 visit. You work with a lot of healthcare entrepreneurs.
Yeah.
What is holding them back from being able to do that? And why are they, leveraging you to get over that hump?
Yeah. It's kind of the traditional way to do insurance. And really, it's the more modern approach now to be value driven. And it's unfortunate because kind of traditional medicine, it was really almost like the providers were doing the patients a favor when they would come in.
Hmm.
You just not get greeted with a smile and wait in line, do paperwork. People's time is valuable. So you're going to wait 2 hours to see an orthopedic surgeon. That's an expensive visit,
Sure.
on top of everything else. So if you're going to be a $500 visit, you need to get people in on time, get them out on time. So there's a lot of mindset around that. And then, previous generations also, it's connected to this mindset, sort of accepted everything that a doctor may have said. So now doctors need to be best practice and evidence-based and, just like in your business, right? They need to be the best solution to a problem.
Sure. I like that value-driven approach, and I think that so when I'm thinking about being value-driven, right? If I'm a healthcare entrepreneur or practitioner, I'm going, Lance, what the hell are you talking about? I'm value-driven every day. I'm fixing people. I'm getting them back on their
Right.
feet. What does that look like to somebody who is maybe in the, coming out of the, old world traditional model of medicine, and what are they missing or what are they not doing? What did we see before? What should we be seeing now?
Right. I think the healthcare world needs to practice what it preaches. It was sort of the first industry to be more evidence-based. And what that means is have like literature and science to back it up. And other industries actually are following medicine. However, it's really in practice not used consistently.
Mm,
And even these third-party payers, I think consistently, if all the healthcare practitioners listen, if you just remind yourself and stay consistent, stay true with the patient being the focus and their best interest. Because so often, treatments are uh, offered or provided that may be approved by insurance and that kind of thing, rather than just saying what's in their best interest. And if it's covered or it's not covered, you can kind of go
right.
with that.
Interesting. So just to kind of give that back,
Yeah.
if I'm sitting there and looking at, hey, there's procedure A, which is covered by insurance, and
Right.
procedure B, in our industry, in the video production and marketing space, it's like, don't make the assumption of, for example, somebody's budget, right? Or right. So, in
Make a
that case,
perfect world recommendation is what I would always say to our physical therapists. They would just maybe make an assumption that, oh, this person wouldn't be able to do 3 times a week and really do if they've got a rotator cuff tear, but to give them the best chance of not having to undergo very painful, very expensive, very risky,
surgery,
surgery.
right? So I love that. So it's the idea of, provide options. Hey,
Yeah.
here's the best case scenario. Here's what you
Right.
should do. And then if they can't for whatever reason or refuse to, you can always work your way backwards from there.
Right.
But I think that's a solid piece of advice that's kind of actionable and immediate. Is there anything else that's like a solid, actionable, immediate, other than sit down with a coach, start looking at your models, start building this thing out? Because and I'll take a step to the side to say that's what's so interesting about most of these practices across the board, right? Whether you're in my space in video production, if you're in your space,
Yeah.
if you're a health practitioner, you probably didn't spend a lot of time in business class. You probably aren't learning modeling and strategy and statistics and probability and, what else affects business, right? Geopolitical concerns, all these different things, the economy, like you're not thinking about those things. You know how to do what you do, but
Right.
now you're thrust into being a business owner. And so I think it's important to have somebody that can guide you, work you through those things.
And I was fortunate enough to have some really strong mentors, Jim Quinn, shout out to him and Marilyn Powell. And I guess what I would say to the healthcare entrepreneurs, yeah, it's probably not your favorite thing to be looking at the numbers and looking at the spreadsheets, but John, right? It's definitely important to keep a pulse on your business and keep a pulse on your numbers. And healthcare practitioners, we are especially bad at looking at the accounts receivable and maybe even knowing our finances that well. But you can't serve the world and keep them healthy if you're not keeping a healthy business. And the line I always like to say is I like to help entrepreneurs have a healthy life and lifestyle first, but also get paid for the roles they have double-digit profitability beyond that, and then have a valuable asset that they could keep or sell for a premium.
Mm-hmm.
So when you talk about profitability, even though your taxes may not be exactly the same, but we should absolutely put a line item for the replacement cost for all the roles you have. And you
Right.
still, when you look at your business, have double digit, and again, a little industry specific, right? Fitness is going to be at the bottom, attorneys and dental, if we're talking about healthcare, but we should probably have 20 to 30% pre-tax margins. So, and that should be after, because by the way, if you want to ever sell your business, then you won't have a valuable asset if your replacement cost would be more than that, and you would technically have a liability and just a,
Fascinating.
yeah,
So it really creates that trajectory. And if you're looking at your numbers, if you're not looking at your numbers, it should be a heads up, right, to any healthcare professionals to go, oh man, I really should be doing that. And having somebody along your side to help you understand what you're looking at, right? Because it's one thing to look at a P&L. It's another thing to actually be able to dive into the numbers and understand what they mean. It's not what the numbers are; it's what that's behind them and what they mean. Um, and I think that you just kind of hit on the last piece that I want to talk about, which is the delegation piece, right? Because you said, hey, look at all the roles you're doing and figure out what your replacement cost is, right? And really be specific about that. So, um, thinking about, we talked about insurance and the pinch from insurance. We'll go back to this one last time. If I'm in the space where, whether we call it a limiting belief or the reality of my business, right? That I, as a healthcare entrepreneur, am not going to go to the out of network model. What are some things I can do right now to make that either more efficient, more cost effective, et cetera? Thinking about the roles and delegation piece.
Yeah, great question. And this probably applies to all industries. And we spoke about this a little bit. I mean, I think we as healthcare professionals need to, looking at our numbers, like know by raw dollars and percentages where our biggest costs are, and need to look at efficiencies, need to look at gaps, like leaks.
Yep.
So if your accounts receivable, for example, was really growing, every additional hour that you spend actually makes your reimbursement less because the value of a dollar decreases, and you may not even collect that money. So knowing those large areas, and on your team part of things, I'm a big advocate for incentive plans and
Mhm.
recognizing performance. So that's another way that, certainly in our industry, right, we had declining reimbursement and the market got really competitive. Everyone wanted to go into home care at one point, like work daytime
Yeah.
hours, make their own schedule, make more money. It was difficult. But we paid just at market or a little bit below market, but then with great performance, people were able to earn 10, 20, 30% more than other outpatient orthopedic physical therapy practices. So that's one way to just really recognize your team, because that'll probably be your largest cost.
I love that. It sounds to me like the best way to scale, grow, create a strong business is to expand on that entrepreneurial model and not just be the only entrepreneur, but make everyone in your organization entrepreneurial within the organization.
For sure.
You're fostering that, right?
Yeah.
You're going to see that growth. Lance, this has been phenomenal to talk about. I hope any healthcare entrepreneurs out there that are watching this are feverishly writing down notes and thinking about next steps, because it seems to me that it's only going to continue to be this kind of closing wall in on healthcare practitioners. And the best thing that they can do is work with a coach, work with a strategist, and take that to the next level.
Yeah, thank you. And for everyone listening, any decision you make, think of it as an investment, and make sure there's an ROI. We don't really get to talk about
Yeah.
ROI much today, but certainly for evaluating coaches and part of your inner circle, any investment. And by the way, be mindful when you look at ROI and you're presented ROI, not necessarily to look at just the top line. Like I've given John this example over the years. If someone was selling us a laser company and they cost $2,000, and an average physical therapy case was $1,000. These are actually sort of national numbers from a couple years ago. They would say, well, as soon as you had 2 patients, right, you're break even. But that's actually not true. The average profit margin is 10%. So you actually need 20 patients
Wow.
to break even, or else you're just going to go cash flow negative. So ROI.
So
Great
yeah, for
performance.
anybody listening to this, that is such important math to understand, and that is part of the value of having a strategy, modeling, and thinking through these things.
Thanks, John. Yeah, I appreciate the opportunity to speak to your audience today, and
Yeah.
it's always a blast.
Thanks, Lance. Appreciate you.